Welcome to the Hidden Heroes Veterans and Caregivers Aging Well series by ElderWorks Educational Services and the Veterans Assistance Commission of McHenry County. Today's speaker, Justin Padoan, is a social worker from the Lovell Federal Healthcare Center. Please welcome Mr. Padoan.
Greetings, everyone. My name is Justin Padoan, and I'm with the Caregiver Support Program at the Captain James A. Lovell Federal Healthcare Center. We're excited today to talk about the Caregiver Support Program and discuss some of the elements of our program, as well as eligibility requirements. And at the end, we'll open it up for any questions that you may have. So we're excited to share our mission, which is to promote the health and well-being of family caregivers who care for our nation's veterans through education, resources, support, and services. Okay, and here's the makeup of our team. So we are an interdisciplinary team, collaboration between social workers and nurses. And so this is our wonderful staff here. Every VA has a caregiver support team with a coordinator to help navigate through various caregiver support resources here at the VA, as well as through community partners and resources out in the community. Okay. So if you can imagine caregiver support as one big umbrella, there are two programs that would fall under that caregiver support umbrella. The first one would be the Program of General Caregiver Support Services, PGCSS, often referred to as the General Program. This is the core of the VA Caregiver Support Program. So it offers the peer support, mentoring, the skills training, coaching, telephone support, online programs, and referrals to resources for veterans or veterans who are providing care. In order to participate, we would need to get the caregiver enrolled in our program. They would also have a collateral chart created so that we can document in that chart, and we will respect their privacy and confidentiality. So as you can see here, this is the General Caregiver Support Services. Okay. And the other part of the Caregiver Support Program is the Program of Comprehensive Assistance for Family Caregivers. So this is commonly known as the Stipend Program, and it offers enhanced clinical support and services for eligible veterans who have a serious injury or illness and require in-person personal care services, among other requirements that we'll touch on this demonstration today. So as you can see, this is the core elements of the caregiver program. PCFC, or the stipend program, also includes the stipend, CHAMVA, which is a form of insurance if not insured already, and then beneficiary travel. So a little bit more in continuing with that previous slide. So the general program, it's for veterans of all eras. And a general caregiver is defined as a person who provides personal care services to a veteran who needs assistance with one or more activities of daily living and or a need for supervision, protection, or instruction based on symptoms of residuals of neurological care or other impairment or injury. On the other side here, we have the stipend program, or the PCFC, Program of Comprehensive Assistance for Family Caregivers. Again, this is that enhanced clinical support for caregivers. But the key thing here is right now it is for veterans that were seriously injured in the line of duty on or before May 7th, 1975. So that would be Vietnam War era, and prior, and then on or after September 11th, 2001. Again, this provides the resources, education, support, the financial stipend, and health insurance if eligible to caregivers of eligible veterans. So first, let's talk about the core elements of the Caregiver Support Program. So we offer education, support, collaborations and partnerships, outreach, resources, and referrals, whether you're in the general or the stipend program. Education and support. So oftentimes caregivers will need education, support, training to successfully care for themselves and veterans. And we achieve this by providing coaching, skills trainings. There's group and individual interventions. There's peer support across multiple modalities. We were able to accomplish this during COVID through telephone work groups. We have VA Video Connect, which is the VA's tele health software for completing groups. We were able to also do some in-person groups and interventions when applicable and when appropriate. We also provide community trainings and workshops, both internally and externally through multiple organizations. So collaborations and partnerships, we understand the importance of wraparound services from both the community and the VA for caregivers and those who have served. So we accomplish this by collaborating with internal VA providers, community providers, non-VA services to help provide support groups. So we often connect with like Age Guide, we work with ElderWorks on some things. And we also like to share any community resource and events that would be applicable to our caregivers. And then also collaborating with the veterans and caregivers treatment teams to make sure that they have a voice in terms of the care that they receive here. Outreach. Caregivers need education and awareness regarding available services at the VA and in the community. So we work with our public affairs office, volunteer services, to make sure that we're contacting, locating potential caregivers or care recipients who may be eligible for care or services through the Caregiver Support Program. We utilize social media, newsletters, town hall participation. Every November, we do have the National Caregiver Month programming. We also have an outreach resource fair and a summit that we offer, including our community providers. And lastly, resources and referrals. So it's crucial to link caregivers to any potential resources or research, referrals that they may require, whether it's navigation through the VA in terms of any support or services. We work with veteran service officers within the community to link them to any VA disability compensation, any VBA related type benefits such as aid and attendance, funeral and burial benefits, and then referrals within CSP. So oftentimes we'll get providers within the VA who have specific questions about support for caregivers. So this is what I like to call our menu of services here at the FHCC or the Federal Healthcare Center. So we do offer caregiver support groups based on locality, because we do have community-based outpatient clinics in McHenry, Kenosha, and Evanston. Right now, we are only offering the McHenry and Kenosha support groups. The goal is to outreach to Evanston eventually. We do have support groups geared towards our veterans who served on or after September 11, 2001. Again, they are split up by locality. There's Building Better Caregivers. It's an online workshop that caregivers can sign up for. Power Tools for Caregivers and Caregivers First. These are both a series of trainings. I believe they are 4 weeks each, in which the caregiver can sign up and go through a curriculum and learn tools on how to take care of themselves. There's monthly caregiver support line educational calls. So there's a caregiver support line, I believe it's based out of New York, that offers a lot of monthly calls. So each month there's a theme related to caregiving. For example, in February, they did a call on self-care and loving yourself. A lot of it is pertaining to preventing caregiver burnout and stress, and each month is a new theme that you can log on via telephone. There's individual supportive counseling referrals for caregivers. So if a caregiver needed more specific support or coaching, we could be available. Reach VA is resources for enhancing all caregivers' health. This is a structured curriculum in which the caregiver can participate via one-on-one sessions or via support groups. This can be done via telephone or our VA Video Connect, which is our telehealth support group or format, I'm sorry. And also, it's very specific to curriculum. So if you have a caregiver who is caring for someone with dementia, there's specific curriculum for dementia. So it's really catered to the goals and needs of the caregiver and their situation. There's peer support mentoring programs, AnyText, which is a text program in which you sign up. It's voluntary, and you can sign up and get up to 3 text messages a day. One text message could be about a goal. The other one could be about self-care. The other one could be about a quote. So it's kind of just like gentle reminders that the caregiver gets throughout the day to kind of have them stop and take a toll on themselves and see how they're doing. SAVE, suicide prevention training. So this is training that we usually offer once a month for any caregivers that are caring for loved ones that have history of any self-harm or kind of those thoughts related to self-harm. And a lot of this information can be found here at the caregiverslibrary.org website. So just a little bit in continuing with the menu of services. So again, here's Building Better Caregivers. Again, that's that 6-week online course that our caregivers can sign up for. This is just a testimony of one of the caregivers that was enrolled in AnyText. And then, like I talked about, REACH is the curriculum that's very specific. So you could see dementia, spinal cord injury, PTSD, multiple sclerosis, ALS, spouses who are caring for veterans after the September 11th, 2001 date. And then caregivers who don't have a specific condition, it could be any caregiver of any era. Okay. So that was more on the general caregiver support program. Now this is where we get into more of the program of comprehensive assistance for family caregivers. Again, if you think about that, that is the stipend program. A little bit of history and background regarding the PCFC program. So as a result of the Mission Act of 2018, it was to strengthen VA's ability to recruit and retain quality healthcare professionals and allow VA to align its organization with the needs of the nation's veterans. This was signed into law in June of 2018, and one of the key areas that helped the Caregiver Support Program was that it expanded eligibility to include veterans who served before that September 11, 2001 date. The expansion occurred in phases, and so that is the next slide right here. So as of October 1st, 2020, the program of comprehensive assistance for family caregivers has expanded and is in currently phase 1. So phase 1 are veterans who incurred or aggravated a serious injury in the line of duty on or before May 7th, 1975. Or on or after September 11th, 2001. Phase 2 is open to veterans of all eras. So phase 2 will expand on October 1st, 2022 of this year. So right now it's currently Vietnam era veterans and prior, and then veterans who served on or after September 11th, 2001. So again, more eligibility requirements. The individual is a veteran or a service member of the armed forces undergoing a medical discharge who incurred or aggravated a serious injury in the line of duty. Again, there are those dates: on or before May 7th, 1975, or on or after September 11th, 2001. So they need to meet a specific date in which they served, and they also need to have a service-connected disability rating of 70% service-connected or more. More on eligibility. The individual is in need of in-personal care services for a minimum of 6 continuous months. So the injury or condition has to be chronic in nature, right? So the caregiver has to be providing care greater than 6 months. And it's based on an inability to perform one or more activities of daily living. So bathing, dressing, feeding, any mobility issues, transfers, toileting, any adjustment of prosthetics, a need for supervision or protection based on symptoms or residuals of neurological or other impairment or injury, or a need for regular or extensive instruction or supervision without which the ability of the veteran to function in daily life would be seriously impaired. Additionally, the caregiver and veteran applicant, the veteran would agree to receive care at home or will do so if VA designates a family caregiver. The veteran will also receive ongoing care from a primary care team or will be assigned one if VA designates a family caregiver, and it must be in veteran's interest. So the veteran has to be enrolled in care at VA. They have to see a primary care provider. If they do have a community provider, they can continue to see them just so long as the veteran continues to do the annual visits with their primary caregiver or primary care team at the VA. What about the caregiver? What requirements must they meet? They must be 18 years of age. They can be the spouse, son, daughter, parent, step family member, or extended family member, or someone who lives with the veteran full time, or will do so if designated as a family caregiver. So, for example, if you have a good friend or neighbor who plans to apply for the program, if they get approved, then that individual would either have to live with the veteran full time. The caregiver will be assessed to determine if they would be eligible to qualify. They have to complete caregiver education and training, and there should be no determination by VA of abuse or neglect of the eligible veteran by the caregiver. So no neglect, fraud from the caregiver onto the veteran. So the benefits include, again, this is that enhanced clinical support in addition to the general support services. There's the monthly financial stipend that's paid to the primary caregiver. You can have up to 3 caregivers apply, so your primary, secondary, and then secondary. But the primary caregiver would be the one who would receive the financial stipend. Same goes for the health insurance, the CHAMP VA. If the caregiver is otherwise insured, the primary caregiver would be eligible for CHAMP VA. They also receive mental health counseling, whether it's related to stressors from caregiving or any other mental health condition. There's the caregiver training, respite care, hero miles, travel and per diem compensation when traveling for a veteran's medical appointment, financial counseling and legal assistance. Those are still in the works, so nothing offered quite yet. And then again, there's the caregiver support groups. We have a McHenry group, Kenosha group, and a Vietnam era group that's currently being run. And then there's the case management piece. And so we'll talk on the home visits and wellness visits in a second. So the requirements for the program, if you get approved, if the veteran and caregiver are approved for a program, there's an annual reassessment that needs to be done each year to determine if the veteran and caregiver still meet criteria. So we really want to capture changes over time. So if they continue to decline, what other services can we put in place, or what would be the plan moving forward? Wellness contacts. So every 120 days, there is a wellness contact that's conducted with the caregiver support team, with the veteran and the caregivers enrolled in the program. And the focus here is to check in, see how both the veteran and caregiver are doing, if they have any goals. It's kind of like our check-in and making sure that the veteran is safe and the caregiver has what he or she needs. Again, these are required as part of the program. So how do you apply? There's a couple ways that you can apply. So there is a 1010CG form that is the application to apply for the Program of Comprehensive Assistance for Family Caregivers. On the application itself, you can complete it and mail it to the Health Eligibility Center in Atlanta. Or you can, if you are at the VA and you wish to apply, you can submit it to your primary care provider. They will let us know. And then the quickest way is to apply here online at www.caregiver.va.gov. If you have any specific questions about eligibility, thinking about the program, not quite sure about the program, please call me. Here's my contact information here. It's 224-388-6640. I'd be glad to talk about the general program, the comprehensive program, or any of the information we shared on this presentation. Just a quick overview of what the application process looks like. So we try to streamline it within a 90-day period. And as part of the caregiver support team, we will make sure that you get through each steps accordingly. So each step of the way will make sure that you are able to complete the steps. So as you can see here, there are some assessments that need to be done on behalf of the veteran and the caregiver. This is where we really try to get the information to submit to our eligibility team, who will then make a decision moving forward. But again, this is just to illustrate the process. It is a nice visual of what the application process looks like. Again, this is our general caregiver line. So we also have a triage line for anyone who wants to inquire about caregiver support. It does go to our team here, so we'll be happy to receive any questions, comments, or concerns. Again, the www.caregiver.va.gov website is also a great resource where you can find information about caregiver support programs, eligibility, the programming, and any updates related to our program. So at this point, I'd like to open up to the audience to see if there's any questions.
Thank you, Justin.
Hi, good morning.
Hi there. Hi there. So that was very good. Thank you for helping us with your presentation today. It was very informative.
Thank you.
I have lots of notes. I don't know if we have any questions. I didn't see any come through. But I have lots of questions because I always do.
Sure.
Just who I am. So this program is strictly for veteran caregivers to get assistance for caring for a loved one with issues. So I'm going to give you some examples. We have a lot of older adults that we work with here at ElderWorks, and sometimes the wives can't use a computer. They're not they're not technical, and they don't know how to get care. So the best way to help them would be to just give them the general phone number, or how would we help those senior wives or husbands call you or get a hold of you? Just give them that number.
Yep. So the 224-610-2273 number, that goes to our entire team. So we usually check that every hour on the hour, and we're all in one central location. So we tag team and make sure that their needs are addressed.
Nice.
We are trying to get out more in the community so that if we need to meet with families, we want to be more available. But with VA, there's so many layers that we have to go through. So right now, everything's through the telephone, unfortunately.
And no telehealth yet for that.
So we do, but the veteran has to be established in care here. So in terms of outreach, we can't quite do telehealth yet.
Okay. All right. Yeah, because it is difficult. I know that we're having some difficulties with my parents getting assistance. Sometimes not everybody's as good as you guys, Justin. Lovell is ridiculously good. I don't know who's seeing this across the nation, but Lovell Healthcare Center in Illinois is one of the best in the United States. And I can guarantee that I know this because we moved to South Carolina and they definitely are not as responsive as Lovell.
Okay, good to hear.
Mm-hmm. Yeah. So the good news is I'm going to give everyone your phone number
Yes, please.
or the 224 number to
Mhm.
get assistance because they're not as responsive. I don't know why. Why is it that Lovell is so forward thinking and supportive and other VAs aren't, other locations in the United States?
I think every team varies. I think we are just very fortunate to have a team of clinicians that take the initiative. Um, we've all at some point have had dealt with the VA, and so we want to we want to promote a positive experience. Yeah.
100%.
Yeah.
100%. And caregivers are important. You know, they're giving of themselves. They're giving everything of themselves. And I want to make sure that they're taken care of because they're the ones that get sick first, as you know.
Mhm.
Right.
Yeah.
So
Yeah.
what kind of tip can you give an at-home caregiver who's taking care of a veteran? Maybe just a little tip to keep their sanity. Any tips for them?
Give us a call. Give us a call because I think part of the biggest frustration is just navigating through VA.
Mm-hmm.
And so having that, I don't want to say like lifeline, but just a resource to get someone on the phone is half the battle, right? Rather than just
Right.
getting transferred from one department to the other department, only to tell them, I'm sorry, we can't help you. Like
Right.
that should not ever come out of someone's mouth here. You know what I mean?
Mm-mm. No.
So oftentimes what I'll say is it's very intimidating at first, but having kind of just an advocate for you helps.
Right. Right. I do have a question here.
Mhm.
It
Yeah.
says, we noticed that some of the participants of the post 9/11 program got dropped off the updated program.
Mhm.
What's the best way for the family to appeal or reapply for the new program?
Yep. So that's a great question. Thank you, Mike. So in terms of the appeal, there's two ways that they can approach this. There is a clinical appeal that starts at the local level through the FHCC or whichever VA they applied from. And that goes to our patient advocates, who then elevates it to our eligibility team to re-review. So they can appeal locally, is how I like to say it, or they can pursue the other VHA options, which I know some of the VSOs are familiar with in terms of the higher level appeal, the supplemental information, and then the appeal to the court or the Board of Veterans, which I believe our program manager has specifically requested to reach out to VSOs to help with that avenue of appealing. And then as far as reapplying, you can reapply at any time. You can apply online at the www.caregiver.va.gov website or complete an application at Lovell or through a mail-in application.
Okay, so the VSOs and the VACs are all working together.
Yes, yes.
I like that there's some camaraderie there because it takes a village and there's no such thing as one solution for everybody. So
Yeah,
I appreciate that.
yeah.
Let me see if there's another question here. Nope, no other question. I think that's the only one so far. Wish there were more because this is a really
Yeah.
great program.
Yes, I was hoping to. Jennifer, can I ask you, because I know, geez, forgive me, I'm forgetting her name, Katie. Katie.
Yes, Katie Brooks.
Yes, yes, yes. I know Katie from when I first started here at the VA, and so we would like to boost like our outreach as well to community providers. Is that
Okay.
something between you and I that or just between our teams that we can kind of collaborate on? Like if you have a
Oh,
referral,
absolutely.
or if we have a referral?
Absolutely.
Okay. Good.
Yes. So ElderWorks believes, again, takes a village. We are not all things to all people. No one is. If they think they are, they're crazy. But our goal is to connect people to the correct resources. And you're a
Okay.
great resource. So, yes, we definitely would collaborate and help you with your reach because it's
Okay.
important.
Okay.
And you have caregiver support groups as well, or no,
Yes.
is it just one-on-one?
We do both. So we have one-on-one coaching, and then we have groups, which again, we're trying to get back in person, but VA is kind of like, well, with COVID, we have to do telehealth. So a lot of our groups have been done through our telehealth software.
Mm-hmm.
Um, I was hoping to get into the McHenry-Seebach again to do groups, also Evanston and Kenosha, which we're kind of trying to get into the works. We also have a general caregiver social worker who left to pursue other endeavors, and so we're hiring someone. So hopefully, once we're a complete team, we can have a more robust menu of groups.
Oh, that's good. And ElderWorks is always looking for folks to manage our caregiver support groups. We have a
Oh,
wide diversity of people that we help. We have
okay.
2 caregiver support groups right now. The first one had over 40 people registered,
Oh,
and then
wow.
we had up to 70. So we're going to open a second group. We really need a third group. It would
Okay.
be wonderful to have a veterans support group through ElderWorks. We would love that. We have a
Okay.
lot of people who just don't know where to go. And so the more we can offer, the better off our families are. I don't think we're all touching the same exact folks, but it would be nice if we could all do that. Hold on a sec. Let's see if there's another one. Oh, here's one. Lynn
Okay.
O'Malley asked, so there's one person from the VA assigned to someone inquiring of services. The person must navigate to figure out each step on their own, or do you help with that?
Yeah, so that's a good question. So thank you, Lynn. If the veteran is enrolled in care, each primary care team has a social worker. Okay. So if you have any specific questions about services related to primary care, or if they have any mental health ailments, or a combination of both, there is a social worker assigned to that team. So we call them PAC teams, patient aligned care teams, which consist of a primary care provider, a nurse case manager, there is a nutritionist, and then there's also a social worker on board to help with those sorts of questions. We often get triaged by the main VA number about any caregiver related questions. So we'd be more than happy to help assist in getting you to the right place. But like I said, if you have a veteran who's enrolled, they have social workers assigned to that team.
Well, that's good.
Mm-hmm.
Social workers are trained better than a lot of other folks in with the interpersonal dynamics of everything, right?
Yep.
I think a lot of the issues we get with our caregivers is they don't reach out for help till they're exhausted.
Yeah.
What I would like is for everyone to reach out before that happens.
Mm-hmm.
I know that sometimes the spouse who is not well won't let the caregiver get the help because they're too proud. They're like, we're fine. We don't need anything. You can take care of me. And I think, is there something you can tell the folks that are watching this why it's so important to get some help for that vet and the caregiver?
Yeah. I think we become a more of reactive society. And so we don't want to wait till the very last moment when we're scrambling to make ends meet. And so I would say just keep up with the primary care appointments, stay in contact with your providers so that you can make a plan ahead of time. Reach out to all the services that are available. Yeah.
Okay, that's a good answer. Oh, look, Mike's here. Hello, Mr. Owanike.
Hi, Jennifer. Hi, Justin. I've been watching. Yeah, sorry I couldn't find the proper link to get backstage. But Justin, there was one thing I wanted to add up, and I'm the one who asked the question about the post 9/11 care. But do you mind sharing a couple of the differences that the improvements over the post 9/11 to the new program now, and how that basically there wasn't some improvements to it, and I'd like to see if you can expound on that a little bit.
Sure. So in general, with the expansion of the program of comprehensive assistance, it did allow for veterans who served prior to the post 9/11 conflict to have access, so such as our Vietnam veterans. Now, specifically with the changes, as Mike has mentioned, a lot of our post 9/11 veterans were not meeting the new criteria as part of the expansion. But we are still continuing to offer those services for those veterans. In the meantime, while VACO is central office is figuring that part out, we are still continuing to provide case management services for both the veterans and the caregivers, making sure that they have the resources that they need. The stipends are still being paid out. One of the things I think that was a slight improvement was rather than having 3 different levels of care, they streamed it down to 2. And so there is more oversight in terms of doing the annual reassessments for our post 9/11 caregivers or anyone enrolled. And then also the wellness visits. We are doing now home visits, which we are now implementing, which is a great move forward rather than doing telephone visits, virtual, because we want to get back into the home and see our families.
Yeah, and I did want to share Jennifer's sentiment that Lovell Federal Healthcare Center is just marvelous compared to what I see across the country. And some of the things I hear, you're very responsive to people. I mean, I'm not saying you're the only ones in the VA system that's doing it right, but it seems there's more that feels less connected to their veterans than Lovell does. And with that said, for those people who are seeing this who may not be in the Lovell catchment area, what can they do as far as trying to get in touch with the right people so they can move these things forward? Because sometimes that can be very difficult for a veteran.
Yeah, no, we get that a lot. So sometimes we're in a kind of geographically unique area, with Lovell being kind of in the middle between Hines and Milwaukee, Madison, and then there's also the Union Grove Clinic. I know, like west of us, kind of falls into Hines catchment area. Jesse Brown's right around the corner, and so we let any veteran know that they can transfer their care, but you just have to keep in mind the distance that is associated with that. We encourage not to fragment care just because it's nice to have one central location. But we do have a couple of our veterans on our panels who have primary care at Hines, but they would prefer to have their mental health at Lovell. So that's an option as well. You can see specialty providers within the VA system. I wouldn't say we don't discourage it, but I think for terms of continuity, it's better, but it certainly can be done.
I wrote that down. So Mike is quite aware of many of the veterans that I interact with, one being my father. And and the issue that they have is there is not any continuity. There is not real support. They're flailing. And I don't think that's right for our veterans. I don't think any veteran should ever flail. I think they should always get the support they deserve. Right. And, we're not selling widgets. We're providing a service.
Correct.
Right. And I think that the VA needs to empower their employees to help better across the nation. I'm not talking about Lovell, just so you're aware. And Mike knows what I'm talking about. It's chaos. It's not enjoyable. Let me tell you, my father's gotten great care at Lovell. He loves it there. He loves all the doctors. He loves all the nurses. He loves his social worker. He loves his counselor. He loves Mike. And he recently moved, and it is not the same. And as a veteran who's used to getting really good support, he's very frustrated, and he's not getting the services he needs. So I got to figure out how to get him services quickly, or there's going to be some issues. And I can see that it's not just my father. All right. We're all transporting across the nation, right? We don't always live in one place.
Yeah.
So I just need to figure out how to get that care for him quickly. And other veterans, I go to these doctor's appointments, and everyone I hang around with is a senior, which I love. And they don't even know anything about veterans benefits. I'm like, how do you not know? So I've been sitting in the mic, and Mike's like, they're not even in my state.
Yeah.
Well, if you have any other advice
for that
for
matter,
those
I
folks.
don't care that they're not in my state. Yes, we're locally funded through property tax dollars. We're taxpayer funded locally, but in order to have the federal accreditation, we can't discriminate against somebody based on where they live. I don't care where you live. You're a veteran, you need help, that's what we're going to do.
Yes.
And that's how I get to see the difference between what happens in the Lovell catchment area and some of these other areas across the country. Lovell, in my opinion, is really superior to much of them and should be a model for everybody else.
100%.
Thank you.
Yeah, now, as far as caregiving, I know you touched on it a little bit, for the people who aren't eligible for the pay.
Yeah.
There's still a lot of valuable information and services for those who need caregiver support and can get that from the VA. I'm not sure how much you talked about that because I got interrupted a couple times.
No, that's a good point. So if you're not eligible for the stipend, we strongly encourage you to apply for the general program. Because like I said, one of the biggest frustrations that I found out is that you just can't get a hold of someone at the VA, or they don't give you the time of day to listen. So we're able to do that. If you are interested in enrolling with the general program, you do have our support from the team. We can also help navigate with resources within the VA, within the community, and just kind of have that sounding board. We don't want you to go through it alone. I think the misnomer is a lot of people think this program is just for the stipend. They see the dollar signs and great, yes, I would like to be compensated for that, but there's also the support behind it. Making sure that as a caregiver, you have the tools you need to be successful as much as possible.
Yeah. And I'd also like to add that, from our perspective, we often get people who, they're not qualified even to get into VA healthcare, usually because it is a family member or a survivor of a veteran whom they divorced and are no longer married to, but they somehow think they're maybe eligible because they were married to them. And, in that case, I'm going to throw a kudos out to ElderWorks because they're probably our top referral for things like that. And, I want to share that ElderWorks is also the first place I went to when we were looking for help for my mother. So, they are also very good. And, my dad, who passed recently, he always gave credit to his care at the VA for living as long as he did. He said, I would be dead if it wasn't for the VA. So, it's the best line I ever got from anybody regarding the VA system and claims and anything was, yeah, the VA is great, but your mileage may vary. And the care my father got was just outstanding. So, for VA healthcare in general, once you're in the system and you're starting to work with the doctors, you develop the rapport with everybody. I have found, even in some of the areas that are more challenging, it is pretty good. And so, I want to give that to the VA and especially Lovell, that, my own personal experience, my family's experience with it is they are very good.
Good. Thank you.
Well,
Thank you both.
and Justin's, one of those givers because he works for the caregivers. He's working to help make sure that our caregivers are also taken care of, which is it's a huge undertaking.
Yeah.
trying to support those families, especially when they're not even sure they want support or need support.
Correct.
Convincing them it's okay,
Yeah.
no one's perfect.
Right. And that's the beauty of this program. You may not need support now, but you may need it down the line, and we're here for you.
Which I love. Thank you very much.
Yeah.
I don't see any other questions. Do you have any final things to say, Justin?
No, I think this was really great. I love the whole format of everything. Thank you, Emily, right? Emily was the one who
Yes,
recorded.
Emily's
I thought that
great.
was pretty nifty. Yeah, but let us know if there's anything we can do to help. And I'd like to see us collaborate more and with Elder Works
Absolutely.
and the
we'll be
VAC.
putting, yeah, the VAC is a great supporter of the caregiver programs. ElderWorks will be putting this on our website so people can also find help.
Oh, good.
But yes, we would love to collaborate more with, obviously, the VA, the caregiver programs, the VAC, because without you guys, we wouldn't be able to do our jobs properly and help support these families. So thank you both.
Yeah, thank you.
All right. Well, we will see you later, Justin. Thanks, Mike. I'll talk to you later as well. Take care.
Take care. Thank you.
Bye, everybody. Bye.
Bye.